Hello everyone, welcome to UPSC Warriors by Unacademy. This is Soundarya. So today we are going to discuss a very important and interesting topic called as Ayushman Bharat. So we are going to comprehensively study what is this Ayushman Bharat all about and why it is very important. It is because it is one of the world's largest health insurance coverage program which is targeting almost 12 crore population in the country and especially the economically weaker sections of the population so as to achieve equity in the healthcare services. So this is the article that was published recently in your Indian Express newspaper. So if you are going to prepare for UPSC, and I have a surprise for you at the end of this video. So stay with me for the next few minutes. After discussing all about Ayushman Bharat, I will reveal what it is. Okay, so what are all the contents that we are going to study today? We are going to discuss its objectives and study the provisions in detail. We are going to discuss the different components that exist and an overview, which is very important. Not just studying what are all the initiatives covered. I mean, what are all the services covered under Ayushman Bharat or who are eligible, non-eligible. In addition to that, how it is working, how it is going to make India a Viksit Bharat. Because we all know that India is moving towards what? Achieving the status of Viksit Bharat, that is developed India, right? So how this particular Ayushman Bharat initiative is going to help India do that. So that is going to be very important, and especially if you are someone who is going to attempt UPSC, then it is definitely for you. So please stay with me without much delay. Let's get into the topic now. So what is this Ayushman Bharat? It is basically a health insurance program or a scheme launched on September 2018. Okay, so from 2018 till now, it has included so many beneficiaries under a proper insurance program, okay, by where they are eligible to get up to 5 lakh rupees of money for their medical treatment. Okay, so it is basically targeting the economically weaker sections of the country so that each and every individual of the family who is falling under the category can avail medical services up to rupees 5 lakh per annum. So there is no restriction on the number of members in a family. So this is something being offered to a family who is falling under the category. So no matter how many members are there, even 1 member, 2 member or 3 member of a family can also avail this particular benefits. Okay, so let's discuss everything in detail. So it is one of the world's largest health insurance program, by means of which I try to say that approximately 10.75 crore people have so far got benefited out of this program, and it is aimed at covering 500 million population, that is 12 crore approximately. Okay, so this is our target, to include all these population in a proper health insurance program. Okay, and then it is getting implemented by the National Health Authority, and NHA is the nodal agency for implementing this program. Moving forward from here, what are all the important objectives of this program? Main 3 objectives includes improving the health outcomes, not just providing the people with some medical packages, but also trying to improve the quality of the health services that are there in the country. So talking about the accessibility, talking about the affordability and everything, even talking about the quality of the treatments or the medical facilities that we have. So it covers all range of things. We will study that in detail when we are discussing the provisions. And talking about reducing economic burden, it is very important. Why? Because it is estimated that every year about 60 million of people, 60 million population is falling into poverty because of getting trapped in this high cost medical services because of their increased out-of-pocket expenditures on the medical services that they claim. They are falling into poverty. They're not able to get out of the poverty and they are continuously trapped in the poverty cycle. So that is why this scheme is going to be a game changer, and this is something which is actually taken somewhere about 50% of people from being in the vulnerable category of falling into poverty because of their high out of pocket expenditure. So this fact is based on your consumption expenditure survey, which says that because of having Ayushman Bharat program in place, we were able to lift about 50% of the population from the vulnerable category. Okay, so that is how the scheme is very, very significant. And talking about healthy and dignified lives, of course it has to be there. So that these are all the important objectives of your Ayushman Bharat program. And moving on to the components, we have two important components covered under this particular scheme. One is the Pradhan Mantri Jan Arogya Yojana, so which is going to offer the financial benefits of providing 5 lakh rupees as insurance coverage, and another one is health and wellness centers, which will deliver primary healthcare services. So what are all the two components that are there? One is Pradhan Mantri Jan Arogya Yojana, and another one is the health and wellness centers, which has all these provisions in place. So remember these two components, and now we are going to get into Pradhan Mantri Jan Arogya Yojana in detail. So far we have studied what it is and what are all its objectives. Moving forward to its provisions, so these are very, very important for you to know. So we will talk about its features, we will talk about the fund, the mechanism, okay, so whether you have to pay any premium or not. We are going to talk about what are all the expenses covered, eligibility, beneficiaries, and this is the surprise element that I have for you. So talking about the features, so first of all, it is targeting around 10.74 crore, underline this word, that is vulnerable families, okay, so which is approximately again 500 million individuals. And what is the insurance amount that we can get? It is up to 5 lakh per family. So it is not 5 lakh per individual. If there are 3 to 4 members in the family, they all of them put together can claim 5 lakh insurance. Okay, so if a person is claiming 1 lakh, if there is another person who needs 2 lakh, then he can claim, but only 5 lakhs per family. You have to be very clear with this. Okay, so then it is for both secondary as well as tertiary care hospitalization. So it is not just for secondary, it is also for tertiary care hospitalization. And this is one of the very, very, very important provision that makes Ayushman Bharat so special. That is, there is no need for any kind of upfront payment. So you don't have to pay anything initially and then get it reimbursed later. So there is no payment and reimbursement. You can simply show your Ayushman Bharat card to claim these insurance services. You don't have to spend even a single rupee for getting admitted to the hospital or for getting diagnosed or consulted for taking tests, nothing. So this is something that makes it very, very special, because according to the findings, it was said that because of not having the initial consultation fees, there are so many people who actually succumb to injuries, succumb to their problems, succumb to their health issues. And that is why this scheme is very, very important, because you don't have to spend anything initially. And talking about the restrictions, again, there is no restrictions on the number of members in the family. Even 5 members, 6 members can claim this insurance, provided they should not cross the limit of 5 lakhs. And then it ensures cashless and paperless treatment across public and empaneled private hospitals. Cashless treatment is again one of the very, very important feature that you have to remember. And what is this term empaneled private hospitals? It simply refers to the hospitals which meet the minimum requirements and having some connections or a network with the insurance team. So this is all about the important features. So it is going to target the vulnerable sections of population of about 500 million people, and it covers insurance up to 5 lakh rupees per family per year, and irrespective of number of members to avail it. And there is no payment and reimbursement provisions, and there is no restrictions on the number of members to avail, and it is entirely cashless. Okay, so this is all about features now. So moving forward from here, we are going to see about how this fund sharing is going to happen. Whether as an individual you have to pay any premium for this, of course not. The entire cost of this insurance is something going to be handled by the government only. So it is entirely funded by the government in the ratio of 60:40, that is central government and state government. Okay, so and that is 90:10 for northeastern states. We have different provisions, right? So in the northeastern states, central government is going to be a 90% of the funds, and the state governments will contribute to 10% of the funds for this particular scheme. Okay, and also in addition to northeast states, we have Himachal, Uttarakhand in place. So again, where the sharing is 90:10, and it is 100% centrally funded for union territories. So if you get any question in your prelims asking about how this fund sharing happens, or whether you have to pay any premium, because in the pension scheme, that is the problem that we had, right? So we have to contribute to the premium. I mean, we have to contribute to the monthly pension funds. So that is actually a problem, but there is no such problem when it comes to Ayushman Bharat. Everything will be completely funded by the government. Of course, both central government as well as state government. So don't forget that. Okay. So and then what about the expenses covered? See, totally we have these many expenses covered under this particular scheme. Initially, before few years, it was about just 1350 medical packages covered under this particular scheme. But now it has been increased to 1929 medical procedures. Okay, so not just 123, 1929 medical procedures, and so many changes have also been brought into this particular Ayushman scheme. We will talk about all those things in a while, right? So talking about how it got expanded, how the beneficiaries got expanded, and how the treatments, are also expanded by adding few more treatments like cancers, etc., etc. We will come to that later. So this is a glimpse of what are all the expenses covered under this particular scheme. So it includes medical examination, it also includes treatment, of course, consultation, even surgeon charges, medicines, even not intensive as well as intensive care services, diagnostic or laboratory investigations, accommodation benefits, that is like OT or ICU, whatever it is, and even the food or expenses related to complications during the treatment is covered. So it is basically trying to provide a comprehensive coverage of all the health related services that one would avail for. Okay, so in addition to this, it is also providing you all the expenses that you have to bear 3 days prior to admission to the hospital. So this is all about the coverage, which is very, very holistic. Okay, and moving forward from here, we have the eligibility. So who are eligible to get this particular insurance? It is targeting the economically weaker sections of the population. So those who are living without any permanent residence can afford this. Okay, and then families registered in the socio-economic caste census 2011. So this is something which is important for your prelims. If at all you are getting a question from any scheme, so these are some of the areas where you have to give more focus upon. So it is not provided for everyone. It is not provided for BPL families where we have a special insurance scheme to cover that. So it is targeting only the economically weaker sections of the populations, of course BPL, but we have different set of conditions for that. Talking about families registered in socio-economic caste census and families registered in Rashtriya Swasthya Bima Yojana. Okay, and this is again a insurance scheme which is targeting the unrecognized sector people and the BPL people. So if you are a BPL people, you will automatically fall under this particular scheme, but it is not focusing only on the BPL, but in general it focuses on the economically weaker sections of the population. And to give more clarity, we have rural coverage and urban coverage as the divisions here. So under the rural coverage, we have caste census criteria, people who are deprived in some of the conditions under the socio-economic caste census. And then we have urban coverage where people like rag picker, beggars, construction workers, laborers, painters, even those who got freed from bonded labors and all those things, bonded labor and all those things. So everything is getting covered under this Ayushman Bharat program. And then who are not eligible? So this is something you can have a quick glance. See, who owns a farm equipment, okay, who owns two-wheelers, of course four-wheelers, who is actually working as a government, as an employee in government managed non-agro enterprises. Okay, so who is earning more than 10,000 per month, who is having a refrigerator and a landline connection, so who is already having a Kisan card, with credit limit of up to 50,000, and then who is actually a government employee, who is owning a proper house, and who is possessing minimum of 5 acres of agricultural land. So these people are not eligible to get this benefit under the Ayushman Bharat scheme. I hope so far everything is clear now. And then talking about the overview, how it is able to bring changes in the country. So we can talk about these perspectives. So these are the points which is important for your mains. If at all, if there is a question about how Ayushman Bharat is able to bring people out of poverty, or how Ayushman Bharat is actually helping you to provide equity in medical services or whatever it is, then you have to talk about these points. So let's see it one by one now. So reducing financial barriers and ensuring access to care. Of course, it is reducing financial barriers because it is entirely cashless and easy to afford also. Just that you need to have that Ayushman Bharat card in your hand, and you can go to any hospital, which is actually what, as we discussed, is having the minimum basic requirements and having a tie-up with insurance. And then improving health equity and reaching the underserved population. So what is equity? It is providing the people with what they are actually deprived of, right? So it is not about providing equal things to everyone. It is about providing what is needed for whom. And talking about this Ayushman Bharat, it is basically targeting the economically weaker sections of the population, right? So in that sense, it is helping to achieve equity in medical services, expanding the range of treatments available. So it is not just limited to only few set of treatments, but it is also, going to deal with a large amount of treatments which got recently added into it, talking about your treatments related to cancer. Okay, and then we also have so many other expansions in terms of the eligibility criteria, where in order to benefit the senior citizens people, the government has also included people who are 70 years or above are included under the scheme. So these are all some of the recent initiatives taken so as to provide a comprehensive coverage under this particular scheme, and empowering the families through cashless treatment. So these are certain points you can write about. Okay, and then talking about the notable aspects, it is integrated with primary healthcare services. So we have a separate mission for achieving primary healthcare. So it has been now integrated with this Ayushman Bharat, so that in addition to providing secondary and tertiary hospitalization facilities, we are also going to improve this primary healthcare services. So enhancing healthcare delivery through technologies and innovation. Of course, this is a point you can discuss about, and you also have about 1,75,000 Ayushman, Angadis, like where you will be provided with important medicines, diagnosis, and everything, consultation. So everything is included in that. Okay, so it is Arogya Mandirs, Ayushman Arogya Mandirs, not Angadis. I'm sorry. It is Arogya Mandirs. Okay, so where you will be able to get consultations, where you will be able to have diagnosis, and most importantly, essential medicines will be provided. So these are some of the steps taken recently. And then recent expansions and inclusivity, as I told you, it is about including the people who are, aged above 70 years and so on. And then strengthening the public hospitals and reducing economic vulnerability. So these are the points you have to write in your mains. And this is the last part which I was talking about in the beginning. So now we are going to write an answer to this question. So because we have seen so many questions asked in your UPSC, which is again, referred from any of the articles in your Hindu or the Indian Express. So these are the sample questions that I have. So MAP refers to mains answer practice. Now we are going to see, if at all, if you get any question from Ayushman Bharat, how we are going to deal that. So before moving to that, let's have a quick look at the type of questions being asked from schemes. See, what are all the salient features of National Food Security Act? How has the Food Security Bill helped in eliminating hunger and malnutrition in India? So basically, these are some of the things discussed in your newspaper, and these are the types of questions you get. Okay, so quickly let's go to this question. This is a sample question which I have for you today. That is, discuss the features of Pradhan Mantri Jan Arogya Yojana. How would it help in ensuring ensuring prevention of people from falling into trap of poverty. So if at all, if you get a question for 10 mark based on this, how we have to write the answer with whatever we learned so far. Okay, so we can try giving introduction either of this type or of this type. So talking about this introduction, here I have started the answer with a fact saying that about 60 million of people fall into trap of poverty due to the healthcare cost every year. Okay, so high out of pocket expenditure. So PMJAY aims to address this by providing accessible, affordable and quality healthcare. So this is a decent introduction where you are actually giving a fact so as to signify the importance of this Ayushman Bharat, and then trying to objectify it, trying to add the objective of this in the introduction. Okay, so we can also try one more introduction where we can say that Ayushman Bharat is a centrally sponsored scheme aimed at minimizing medical expenses of people. Okay, aimed at minimizing medical expenses of people by rapidly extending access to hospital care for 500 million poor and vulnerable people. So here also we have a fact. So this is how we can start the answer with introduction. And remember, for questions which is asking you what is, or for questions which is starting with explain type of derivatives, you have to probably start with the definition. But for these type of questions, you can start with some sentences highlighting its overall significance. Because what was the question here? The question is about discuss the features of Pradhan Mantri, okay, Jan Arogya Yojana, and how it is going to prevent people from falling into poverty. So your answer should revolve around these two things, right? So since it is asking you to discuss the features, we can start with highlighting some of its salient aspects. That is, it is going to provide accessible, affordable and quality healthcare. Okay, moving on from here. So what can you write in the body of the answer? So I would suggest you to start with a diagram. It can be a flowchart or whatever you feel like making for this question, where you can highlight some of the key features in this format. You can talk about the coverage. It covers secondary and tertiary hospitalization. We can say that it is NHS who is going to play the nodal agency role, and you can say that it is basically going to target the vulnerable sections of the population, and it is basically cashless. Okay, and it is also not demanding us for any upfront payment, that is no payment and reimbursement. So you can simply talk about all these elements in the flowchart and describe the features in detail in the body. Talking about cashless treatment, cover secondary and tertiary, same thing, right? And then no premium from beneficiaries. We can talk about how the funding is actually planned here, and then no restrictions on number of members, and then expenses covered, and then eligibility. So we discussed the features now, but what is the second part of the question asking us to do? Asking us to write how this particular Ayushman Bharat can help people to move out of poverty or prevent people from falling into poverty. So that is something which is very, very important. Okay, so the slide is missing, so I will tell you. So how you have to give some facts and figures and substantiate it by saying that it is going to provide equity. Okay, so how? Because it is targeting the economically weaker sections and not by means of which it is providing the medical services needed for the vulnerable sections of the population also. You can talk about the expansions that are made. Okay, so you can talk about the medical coverage. Okay, we learned that about 1929 medical procedures are getting covered, which includes not just the procedures like surgeries, but also the treatments, but also the consultations, but also the diagnosis, because these are all the elements, okay, which is actually, putting someone into poverty, because these are all the immediate expenses which they have to, deal with whenever they are diagnosed with any kind of problem, right? Because the first step we have to take is consultation, and then comes the testing stage where diagnosis is important, laboratory and all those things. Without having money for making tests, there are so many people who actually make things complicated, make their conditions even severe, and at the end they end up paying so much of money which they could have avoided with prior consultation and all those things. So you can talk about all these points here, and then finally try to give some facts like about 60 million people are falling into poverty every year, and you can also talk about that about 50% of the people are now becoming less vulnerable to these kind of issues and all those things. So that will complete your second half of the question. And talking about conclusion, you can conclude saying that you can conclude positively saying that it is going to play a pivotal role in building Viksit Bharat, because it is the very, very important foundation for the well-being, national productivity and prosperity. So these three lines can be done, can be returned for a 10-mark question. So this is all about Ayushman Bharat. We discussed what is mean by Ayushman Bharat, what are the important objectives, we studied its components, we studied its features in detail, we studied what are all the medical packages covered, what are all the services that we provide, and how it is going to help build equitable access to the healthcare services of the people. So that's it for today. Thank you so much for watching. If you have not subscribed to this channel, please do subscribe and stay with us. Take care.